My name is Dr. Ahmed Dakshi. I'm a cardiology research fellow and a principal investigator for the MACROS trial. I presented my poster in ESC Amsterdam, August 2023. The poster was titled Imprecision and Clinical Performance of a Whole Blood High Sensitivity Point of Care Troponin I, the first prospective real-time study in suspected acute coronary syndrome. We've independently evaluated the analytical and clinical performance of a high-sensitive point-of-care troponin I assay called the QuidelOrtho. We did this in the context of a nested study in a trial called the MACROS-2 trial. So the MACROS-2 trial is one of the largest studies in the northwest of England, which is assessing the safety and feasibility of the 0-1 hour pathway versus the 0-3 hour pathway. So patients eligible for the trial are randomized into either arms. At each time point, we sample for high-sensitive troponin T, which is used in clinical practice, as well as for adjudication, high-sensitive troponin I, which is a Siemens Italica, which is a central lab test that is NICE approved and validated, and the high-sensitive point-of-care Trop I for Quidel, TriageTrue, both blood and plasma. And the number of patients that we looked at was more than 1,100 patients for clinical outcomes. So the first thing we looked at is the analytical performance. We've performed that by doing the assay Imprecision. We used whole blood for this, and we measured the coefficient of variation at 3 levels. So low level, which is near the limit of detection, and then we did at medium level, which is near the 99th percentile, and we did it at high level, which is 3 to 5 times the 99th percentile. We plotted an Imprecision curve. What we found is that 10% coefficient of variation, we had a value of 10.6, which is more than 50% below the 99th percentile, which is 20.5 nanograms per liter. So in essence, the assay had the characteristics of a high-sensitive troponin assay. Next, we looked at clinical performance, and we done that by looking at clinical outcomes. And the clinical outcomes that we looked at using whole blood was a researcher-adjudicated type 1 myocardial infarction based on the 4th universal definition of MI. We compared, on one hand, the point-of-care Quidel high-sensitive Trop I versus the Siemens Italica central lab test high-sensitive Trop I. We constructed receiver operator curves, or ROC curves, and the area under the curve was an impressive more than 0.97. In summary, the Quidel TriageTrue Troponin I point-of-care assay has the analytical performance and the characteristics of a high-sensitive troponin assay. Its clinical performance is equivalent to a central lab test that is NICE approved and validated. This is the first study to assess the clinical performance of a high-sensitive point-of-care troponin assay using whole blood in real time and in a clinical environment.
Elevate your cardiac care with the TriageTrue High Sensitivity Troponin I test. It operates on a sturdy platform, offering a wide range of cardiac biomarkers such as troponin I D-dimer, BNP, and NT-proBNP. The assay remains stable at room temperature for an impressive 31 days. The assay was the only point of care included in the European Society of Cardiology guideline for the 0-1 hour algorithm protocol. 74% of patients assigned to rule out or rule in zones within 1 hour, on par with top central lab assays.